Welcome back, everybody. Erectile dysfunction is a common condition that affects about 1 in 5 American men ages 20 or older. That's about 39 million American men. Today, we are learning more about the causes of ED and the treatment options. Joining me now is Dr. Matthew Mutter, a board-certified urologist with LSU Healthcare Network. Welcome to the show, doctor.
Happy to be here.
Thanks so much for coming on to talk about this topic. 39 million American men, my goodness. And I got to ask you this, what are some of the causes of erectile dysfunction?
Unfortunately, it's things that are all good in life, things that can cause hypertension, diabetes, that sort of thing that can worsen erectile function.
And is that the reason why we see it as early as age 20, because they may have some of these conditions?
Correct. And typically when it's younger individuals, it's more of a mental health crisis or issue. But yes, things that can worsen hypertension, can worsen or cause both of those medical issues can cause erectile dysfunction.
And what's interesting is that I feel like sometimes there's like a little bit of a question about what really is happening with erectile dysfunction. What is going on medically there?
Yeah, so in order to understand what the problem is, you need to really understand how it normally occurs. And so obviously an erection is a very complex set of events that is controlled by both nerves and blood vessels in the male body. And so that's why diabetes is especially hard on erections, because diabetes can affect nerves as well as blood vessels. And so the combination of, or really anything that can affect the nerves or normal blood flow can cause erectile dysfunction. So the most basic understanding of the cause of ED, the etiology of ED is poor blood flow to the penis. And so whether that's due to a nerve thing, potentially from a cancer operation, or uncontrolled diabetes or uncontrolled high blood pressure that can more so affect the blood flow issues, really any combination of thereof can cause or be responsible for erectile dysfunction.
And here's the good news, everybody. It is treatable. There are so many different treatment options. What are some of the most popular?
So the easiest thing to treat it with would be, number one, lifestyle management. But of course, we understand living here in South Louisiana, it's hard to not eat all those good foods and things that can.
I know.
So, but lifestyle management aside, we're talking things like we've all heard, Viagra, Cialis, oral therapies. They're very safe, but certainly you need to see your provider before you initiate any of those, but they're very safe. So oral therapies all the way up to injectable therapy and penile implants.
Now, when you hear injectables, when you hear penile implants, I'm sure the men out there are like, wait, what are you doing? Let's talk a little bit more about that penile implant. How does that procedure work?
So it is a procedure. You have either a general or a spinal anesthetic, and inflatable devices installed completely on the inside. So you could literally walk around the gym with no clothes on in the locker room, and really many men would not know that you have one.
Really?
Correct.
And this is it right here, the pump?
Correct. That's what you're seeing. This is what we call a three-piece inflatable device. And the reason that it's so concealable is that little reservoir, or that what you would almost like a balloon right there on the top left part. And so during the flaccid state, all of the saline, which is the fluid that's in the device, is in that reservoir. And so the penis is, the flaccid penis is very concealable, and you really don't have any idea that a man has one. When you want an erection, that little pump at the bottom, you simply pump it or inflate it, and the fluid transfers from the reservoir into the cylinders.
And this happens every time someone wants to have intercourse. They just inflate the little balloon.
Correct.
Really? Now, when someone does like a Viagra, a Cialis, like what is that oral therapy doing?
So what that does, again, back to our conversation about the nerves involved in the blood flow. So during sexual stimulation, nerves release neurotransmitters, okay? The neurotransmitters then go to the blood vessels to cause a relaxation, which then increases blood flow into the penis. The medicines, the Viagras, the Cialis, they help keep those neurotransmitters around so that you get increased blood flow for longer periods of time.
But how do we know if we have erectile dysfunction, what sorts of treatment option to go with? Like, how do you prescribe it?
That's a very good question. And so again, we know that when diabetes is the cause of the erectile dysfunction, because it affects both the nerves and the blood vessels, typically those men don't respond as well to the oral therapy. So even though we don't forego oral therapies, we certainly make sure that they understand there are other therapies, to not give up hope if the pills don't work.
Good to know that there are treatment options out there. Men, you're welcome, and your partners, you're welcome as well. Dr. Mutter, thank you so much for being here and talking about this very important topic. And look, if you want more information about the available treatments for erectile dysfunction, log on to edcure.org or call 504-412-1600. They do have an office located at 3601 Houma Boulevard in Metairie. Stick with us, everybody. We'll be right back.